She was quoted as saying, "I looked like Cyclops, one eye was different to the other, I looked terrible, I'm like a hunchback." Hello, I'm Dr. Julian De Silva. I'm a board certified facial cosmetic surgeon. My practice is based in London on Harley Street, and I specialize only in facial procedures. And today what I'm going to talk to you about is a very important topic, which is healing after facelift surgery. Now, Sharon Osbourne recently revealed that she had a horrendous facelift done last year. Now, at this time, Sharon Osbourne was 69, and most of the quotes were taken during her healing period, and subsequently she has toned down some of what she initially said. It's really important when we look at this to consider, well, what is actually the reason behind this? Healing is certainly a journey, and initially you do look worse, and principally this is because of swelling, and we're going to go into this further. My interpretation of a good outcome is a happy patient. Their expectations are reached or even surpassed, they're fast healing, they've achieved the result that they really wanted, and they have no complications. When it comes to bad outcomes, they can absolutely occur. So first of all, let's talk about surgeons. So no two surgeons are the same. My practice, I specialize only in facial surgery, and so facelift, deep plane facelift, vertical face restore, this is something I do for my patients every single day. But other doctors may have different areas that they specialize in. Now, there are three kind of elements that make up most of aging. One is gravity, secondly is loose skin, and thirdly is volume loss. Every single person has a different element of those three things. Some people have more effects of gravity, some people have more loose skin. Particularly if you have hypermobility, if you can bend your thumb all the way back to your wrist, like some of my patients can, then your skin is more elastic, and so that is going to affect healing, and it's going to affect the final result. Some people need more volume, and that can be through fat transfer, can be through lifting the face, through vertical face restore, lifting the anatomy to where it used to be. And then also non-surgical treatments such as fillers can also have an effect. Now, previously I've recorded a video on how to choose the surgeon that is right for you, and that can be helpful in order to mitigate some of these factors. Now, in terms of lifting the face, well, it's very important the technique that is used. Now, commonly, SMAS facelifting was done, and this is where most of the surgery is done just in front of the ear, and it lifts the face towards the ear. That definitely makes a difference. However, I would say a more advanced technique is lifting against gravity upwards. That's a vertical deep plane facelift, and that will restore the anatomy in where it used to be. So different techniques will give different results. So in other words, facelift surgery has to be tailored to you, the individual, because your facial characteristics are unique for you. So key to a good experience, good healing, and good outcome is a real understanding of what recovery is. Certainly Sharon Osbourne, it really sounds like she was not really properly prepared in terms of the healing and recovery. And if that's the case, well, that can be a bit of a surprise. Myself and my team, well, we go out of our way to really prepare our patients for treatment. And that really means giving lots of information on what the healing is. Now, it's true no two people have exactly the same genetics, so no two people have exactly the same recovery. However, the first 3 days, swelling is the really significant factor. And when you're not used to seeing swelling, when you look in the mirror and see puffiness, it can be a little daunting, and particularly the cheeks tend to be more swollen, and because your eyes, the skin around your eyes is less than 0.5 millimeter, it can really swell, and that swelling can distort things and stretch things. And although there are measures we can take to reduce it, some degree of swelling is completely normal, and it's without question the first few days you can look really quite different, and you can look in the mirror and think, oh my goodness, what have I done? But by the 4th, 5th day, the swelling will really start to come down. Now, on average, in my patients, 80% of swelling goes somewhere between 2 and 6 weeks. And even though we can understand this as a principle, surgery is really an emotional thing, and recovery can be quite emotional. In the first few days, even providing lots of information, I would say for at least a third of my patients, anxiety about how they look can be a factor. And this means really having good support during the healing. And myself, my team, we provide what I think is excellent service and support for my patients, advising them what they can do to speed up healing and reduce swelling. However, if at home you have like relatives, partners, a spouse who's not quite as supportive of you having the surgery, that can be a challenge, because really you're at a vulnerable point in this journey, and emotional support is definitely very helpful. Now, there are things that will help reduce the swelling quicker, such as lymphatic drainage, such as hyperbaric oxygen. However, some degree of swelling is just completely normal. Why is this kind of like underestimation of having facial surgery? Why do people think I'm just going to recover really quickly? And I think it's partly because of social media. It's partly because some people do heal really quickly, and so we have in a way a belief that we're going to heal fast. However, facial surgery is definitely not a quick fix, and surgery does have some recovery. In the same way, if you had surgery on your knee or your arm, you wouldn't expect to like do exercise straight away. Well, similarly with any facial surgery, there's going to be this recovery. Now, generally by 2 weeks, in most people, 80% of the swelling has gone down, and most people look pretty reasonable to go out to the shops. However, not all of your swelling will go in that time, and so key also is your personality. Now, if you're someone who's a little more self-conscious and a little reserved, then you should allow a little more time for healing. And I advise my patients really to have 3 weeks. Now, when we talk about the final outcome, well, when all of the swelling has gone, it really can be as long as a year after facial surgery. Now, you will notice a good improvement way before that time. However, that initial period, like Sharon Osbourne was talking about, well, that can be much harder because there's so much going on in terms of swelling. Other things can take longer, like sensation to touch. Well, it's 100%, it's numb initially to touch. However, that does improve. However, I would say 90% comes back really over 9 months, and then the very fine sensation can take even longer. Often, it will feel a bit hard in certain areas, and that hardness will absolutely soften, usually somewhere between 6 weeks and 6 months. And no one can see that, but that is something that you can feel. What about the incisions? Well, I myself, I look to hide the scars behind the ear. Well, no one can see that scar, but you can feel it. It can feel a bit lumpy, bumpy in the initial period. In front of the ear, depending on very specific factors, I will hide the scar along the aspects of the ear that has natural curves. And that will make the scar discreet, difficult to see. However, no scars are invisible. And initially, in that early healing period, scars tend to be a bit pink, and they tend to be a little uneven, a little lumpy, bumpy. Now then, over the healing period, scars remodel, and the collagen fibers that initially like a ball of wool in every direction, they remodel and they become parallel, and the scar flattens down. And as that happens, the scar gets more and more discreet. Now, there are definitely other considerations like ethnicity, regenerative medicine be used to enhance scars. There is a small percentage of people, about 1% of people, who can have keloid scarring. And that's not in relation to like how the surgery is done or the surgeon. That is based on your genetics, and that can require additional treatment. As well, the final result of any scar can be as long as 18 months. And so there are things that can be done in that early period, such as the use of a concealer to camouflage the scar. Eyes, well, often in the early part of the surgery, eyes look different. There's often some asymmetry. The swelling in this area can just change the shape. And although certainly in my patients, we preserve the anatomy of the eyelid so the shape is identical after surgery, that initial period, the eyes can look a little different because the swelling in the very fine soft tissues of the eyes, it just changes things. The most important thing in the early healing period is to trust your surgeon. Go back to your surgeon for reassurance, because healing is an emotional journey. And as long as you trust your surgeon, he can help you recover. Now, when it comes to healing, there isn't like one single thing that we can do to speed up recovery. It's lots of little things. In the first few days, using ice, cold compress, those things can make a difference. In my patients, I have patients have like a special cooling mask that first 24 hours, and that really reduces swelling in a powerful way. There are other things as well, like sleeping with your head slightly elevated, the use of very specific medicines like anti-inflammatory medicines. I give all my patients like a modest dose of anti-inflammatory medicines, and very occasionally I have a patient, even like a couple of weeks ago, a doctor who felt they didn't want to take that medicine. Almost always those patients will have more swelling. However, all these little factors can make a difference, so I would encourage you to listen to your surgeon and take on their advice. Now, the other thing that we should talk about is complications. And in terms of bad outcomes, well, there's no procedure that has zero risk. There is always a small chance of a complication. Now, we can take measures to mitigate them, reduce every single one, but we can never make them zero. In terms of scientific papers, we know that with face and neck lift surgery, up to 10% of patients can have what is called a hematoma. And what that is a large bruise. It can be the size of a golf ball, a tennis ball, or even larger than that. And in my patients, it's much less than that. It's more like 1%, but we cannot make that chance zero. And so, although these things can occur, in those situations, it's so important to listen and trust your surgeon because they can guide you through the healing recovery. One of the most feared issues with face and neck lift surgery is stretching of a motor nerve, because that can give you some degree of asymmetry. And although that tends to improve, it improves over a period of months. And so something like that is frustrating because the healing is longer. But there are measures, again, that can be taken to speed that up and speed up recovery. What about expectations? Well, in a way, expectations is a tricky area because there's no way of measuring expectations. And I certainly ask my patients to bring an old photograph so we can look at how their unique face has changed over a period of time with facial aging. And I can use that old photograph as a template for surgery. However, expectations for surgery are kind of key because although we can improve things, and certain things we can improve a lot, certain things are a little more challenging. Some things in life we just cannot change. There's a small proportion of people who can have swelling in the area of their cheek, and that swelling is sometimes called malar bags or festoons. Now that swelling can be really difficult to treat because we don't know exactly why some people get malar bags. We know that there are certain things that can help malar bags, and that includes a whole number of different non-surgical and surgical treatments. However, there isn't anything that is curative. It just makes it go away. And so, although malar bags, festoons is something I always discuss with my patients before surgery, it can be frustrating because it's something that we cannot 100% fix. And then finally, it's worth talking about emotions because that emotional journey, well, it can be relatively smooth. It can be a bit of a roller coaster. Now, if you've had like any kind of recent life event, like separation, issues with work, professional things, it's always better to let that initial dust settle because if you're in a bit of an emotional state, it will make the recovery an emotional roller coaster. So you want to be in a relative plateau. Now, all of us under the surface are emotional, and recovery after healing is an emotional journey. And having a positive mindset, having a supportive team that can guide you through the recovery, well, that can be really helpful in terms of healing. So I think with Sharon Osbourne, well, although I don't know her specifically and exactly how things happened, it really seems that early healing period where she had much swelling and things were slightly different, her expectations for healing and recovery were different from that. And the key is having really good information and good support during this. Thank you so much for your attention, and I hope this information has been useful for you. Thank you for watching.